All right, everybody, welcome back to another one of our live streams, our QuaranSTREAMs, Answers for COVID-19. Today, we're especially excited to have Joanna Hemmat, who is Assistant Director of Health Services at the Fairfax County Health Department, who's going to be joining us a little bit later in our live stream. As always, we'll start with general updates on the school system. As many of you know, our school board did have a meeting today, from 10 a.m. all the way to past 3 p.m. discussing a number of topics. So I'll give a quick update on that. And then we will get right into our health update, where we want we'll hear a little bit from the health department, and then you'll have the chance, of course, as always, to ask questions live. So general updates in our community. As always, in the city of Fairfax, city of Falls Church, and Fairfax County, there are currently 1,375 COVID cases with 30 deaths. 75 of those positive cases were today. So, as always, make sure you maintain the social distancing, stay safe and healthy, and take care of your loved ones. A couple quick things. So the independent research from the EAB it looked at the 7 WABE Washington Area Board of Education school systems, and actually found that FCPS, as of this point, provides the most synchronous and asynchronous instruction compared to the 9 neighboring counties, which are Loudoun, Alexandria, Arlington, Falls Church, Manassas, Manassas Park, Montgomery, Prince George, and Prince William. So an interesting tidbit as we move forward, many of you know we have 190,000 students in the school system, so it's a priority to continue supporting them. So as I mentioned, the board did have a meeting today. The budget process is ongoing. Last week we had a conversation about what is projected to change as a result of COVID. Today we looked at the superintendent's proposal and his adjusted portion of the budget, in addition to a number of things, which I'll run through fairly quickly. And we'll go into in more depth on Sunday when I do the QuaranSTREAM with my colleague, Melanie Marin. And then on Monday, there will be a budget work session where we talk in more depth about the various amendments, proposals, and see what's gonna happen moving forward. Of course, I will also provide an update on the Blackboard situation, which was another key topic in today's school board meeting. So those were the primary pieces. So let me just share my screen here real quick to show you guys where you can find out a little bit more about today's meeting. So as always, you go into full menu, click on school board. And then board docs, where the school board houses its materials, attachment, the agendas to the meetings. This was the meeting from today. And to the left here, you will, as soon as we click view the agenda, you'll notice the agenda for today. The new business piece was moved forward. So when you look at it, if you'd missed it on TV, you'll find it on the YouTube channel as well. First was the distance learning update, where the discussion happened on Blackboard. And I'll comment on that in a little bit when we talk about academics. And then, of course, the budget update, which Dr. Brabrand had presented along with his staff. So I'll just go through really quickly so you guys have a big picture idea of what was in it. And like I said, Sunday we'll go into more depth. So the idea was looking at how potentially we're going to be reducing some of the costs that exist. As you may remember, the school board previously had asked staff to do a deep dive into our expenses to see where savings can be made. This is an updated impact on the sources of revenue for the school system. So the money that's coming in, from the state, federal, county, since the last time. This is the expenditure revision. So essentially where the proposal from staff for potential changes in where we're going to be spending. And these will all be explored in more depth in upcoming budget meetings. This is the particular recommendations coming from Dr. Brabrand about his portion of the budget, the additions that he would suggest. A number of these look at school support and whatnot, special education, in anticipation of the deficits that we may expect to see in the fall. So you can look at this in more depth. Again, we'll discuss it more on Sunday. This is the list of amendments that is coming forward from school board members for the budget. There's going to be discussion on whether we want to consider any of these given the financial circumstances. This was in response to the school board's request, which many of us, including myself, made to see where savings can be made. So this is staff's attempt at showing us where those cuts or savings, I should say, can be made at 1%, 3%, 5%, 10%, 20%, depending on how deep we want to go. And then, of course, this is in anticipation of other things we may want to consider adding or bolstering in the budget in anticipation of the impacts of COVID. And finally, this is the timeline. So, as I mentioned, so the 16th was today. Last week was the initial conversation. The 20th will be Monday when we have our work session discussing this in more depth. If you have any specific questions that you're interested in on the budget portion of the meeting, of course, you're welcome to ask them in the Q&A. But for now, this is just a broad overview so you know what dates to follow along on. Okay, moving right along. So before I go into the Blackboard piece and academics, I'm going to have Kimberly give us an update on food and technology.
Okay, so with food, so we threw out, hold on, numbers. As of now, we've delivered 380,069 meals. And there's a new site at Daniels Run Elementary School for grab and go lunch, and that will begin Friday, so that's going to be tomorrow, from 9:30 to 10 a.m. And there'll be several sites for grab and go lunch, and for the daily participation. So there have been several sites for grab and go lunch that have had participation of 500 to 1,000 people. So just a reminder to check the websites for locations and bus stops so you make sure that if you're in need that you're able to grab a lunch and a meal for you and your family. In terms of technology, so as of the 14th, there's been 14,323 laptops given out and 559 MiFi devices. So language arts and math videos from Apple 21 are now available on the Fairfax County Distance Learning YouTube page. So if you're looking for that, make sure to check that out on our Distance Learning YouTube page.
Thank you, Kimberly. And as always, if you have not received, technology that your family needs, be sure to get in touch with your school principal. Okay, so let's discuss this Blackboard situation. There's a lot of concern from the community. Kimberly's laughing. This has really been a tough situation. Anecdotally, my brother, was in class on Tuesday, had some great experiences in some classes, some not so great experiences in others. And I've heard you guys similar to Kimberly, I've heard you guys, loud and clear. I've been getting tweets and Instagram messages and whatnot, sharing all sorts of stories. You may have seen my post asking for those stories on Tuesday. And the others that came in afterwards as well. I'm aware of the issues. So when we say, the language students are using, racism that's been happening in these rooms, kids changing names, trolling, sharing, links, absolutely unacceptable. There is no excuse for it. And I would highly encourage folks who are particularly interested or, worked up about this to watch the school board meeting, because there was a lot of clear frustration, respectful pushing of staff to say that this cannot happen again and is, fully unacceptable to have occurred in the first place. It's hard to tell, of course, where the particular dysfunction lies. It seems to be a multi-layered problem. For one, Blackboard attended our school board meeting and answered and took accountability for their part of it. My humble assessment is there seem to be a number of shortcomings on our own side. And when I say our own, I'm referring to, to staff here. The board and staff are different, and I'll explain that in a second. But on FCPS's side, namely being a software update that should have been done 3 years ago, and Blackboard had alerted the school system to do it. That had necessary patches that kind of prevent some of the challenges that occurred. So they were the reinforcements needed for this kind of volume and level of use. The staff spoke, and apologized in the school board meeting. Certainly, we're not naive to think that an apology is everything is fixed now, but truly demanding contingency plans. How did we not have a plan B? So now, putting forth strategies to make sure we have not only a plan B, but a plan C and D, and other initiatives that, as I said, if you want to look at this in more depth, watching that meeting may be of interest to you. But truly, some serious questions, tough questions that were raised by my colleagues and myself and Kimberly, actually, to make sure that we are successful by Monday. In terms of where we stand, right now, Blackboard is being shut down. It started actually 6 p.m. today. They just sent out this email to the community. So 6 p.m. today, all the way until 8 a.m. on Saturday, to download the necessary updates and troubleshoot. As we understand it, there is a contingency plan in place that if there are different systems within Blackboard, so if one of them doesn't work, there's a plan to potentially move to another. Questions were raised about that by my colleagues for a variety of reasons, including security. So we are waiting to hear back and expect steps to be taken by staff accordingly. In terms of what your children should expect and whatnot. So as you know, classes were canceled yesterday, or today, I should say, sorry, and tomorrow. From our understanding, staff have said that they will be providing an update tomorrow about the status of Monday. So be sure to look out in your emails for updates on that. If you have any questions about any of that, please feel free to ask, and I'm happy to clarify. I want to remind everyone, staff essentially does their best to come up with the plans for our school system. We rely on them for that leadership. As a school board, our role is to hold them accountable, to ask the tough questions, and to ensure that we're at the highest standards we can be. I myself am a perfectionist. I really don't take this lightly that we would have failed and not had contingency plans and whatnot. And I try to articulate that, while, of course, guys, for the audience to know, showing compassion as well for those in the tough situation now to be held accountable. And who have been in just as tough of a situation as any of us have in this whole crisis. So that's in terms of where we are with Blackboard. I hope that clarified things for everyone. Like I said, do ask questions if there's anything else I can add. And for staff, for the closure the Blackboard shutdown that's happening from now until Saturday morning, that will not impact you. It is one of the different learning environments. So the Blackboard learning environment is different than Blackboard Collaborate, which is being worked on. So it won't affect your ability to access those resources. Okay, so let's talk about academics more generally, some of the updates there, which you're also welcome to ask about, of course. So YouTube now has language arts and mathematics materials. It has videos from Apple 21 that are broadcast on TV and then posted up on the channel. So you're welcome to visit and see the playlists that are available to support your students during this time, and it will be updated regularly. You can, as we've shown before, search Fairfax County Public Schools right in that YouTube search bar, and you'll find the channel with the logo right there. Packets. So as always, you should be receiving a weekly packet if you have not opted out. Packets have been changed into fillable PDFs, as I've noted. So if you are able to opt out, so far we have 6,568 families that have done so, and we encourage you to join them if you're able to. Again, for the environment and for the budget, this is costing us $4 million to send out. So it would be prudent for all of us to opt out if that is feasible for your family. The link is right on the website and easy to find. If you're having trouble, no worries, be in touch. Final update academics-wise for AP and IB. So we do have some information. AP students by now should have received an email with the official AP testing schedule. That email should have been received on Monday, the 13th. If you have not received it, or if your child has not received it, please be sure to contact your school's AP testing coordinator. If you don't know who that is, you're welcome to contact your AP teacher and they'll help connect you. For IB, so FCPS has requested an extended deadline for the required component submissions, and updates will be provided by your teacher and IB coordinator in the days ahead. Okay, so with that, we'll move to Kimberly for a special ed update.
Okay, so in terms of special education, FCPS will be implementing a temporary learning plan, TLP for short, for our students with IEPs, and that outlines special education services during distance learning. So special education case managers will work with parents about the temporary learning plan for each student, including prioritized goals, accommodations, and other continuity of learning services. So, and the TLP will be sent out as a letter. So there is a new page that's dedicated to special education during COVID-19. And I'm gonna just show you guys how to get there. For me, I'm really bad with just getting places. So what I ended up doing is like I did last time, I searched up, hold on, let me just screen share while I'm at it. Here we go. Then we're gonna, so I just searched FCPS continuity of learning. And I look at the resources here. And based on that, hold on, let me get back to where I was saying where it was going. And actually, I think what I did was actually distance learning. I looked for distance learning support for students with disabilities. And from there, they have the whole page right here. And then with that, they have a bunch of different resources that they can find right here. And so if you're looking for the new website, they should give out different new resources. When they come out, they'll most likely be on this page. So I'm just gonna repeat what I said before. It's the distance learning supports for students with disabilities. So if you search that up, it should be the first one that pops up. Let me stop screen sharing so I can finish off. There we go. And special education teachers will be holding annual IEP meetings for those who are due in the next 8 weeks via phone or Blackboard Collaborate. Eligibility meetings will be held via, of course, like we said, phone, Google Meet, Blackboard or Blackboard Collaborate, and an extension of a 65-day timeline can be requested for students that were in the evaluation process before the shutdown. And the Office of Special Education will be providing supplemental learning packets for students with disabilities. And there'll be one packet focused on pre-K and another one focused for instructional activity for K through 12. And then there'll be another will focus on support learning. So like tips for routines and social skills, et cetera, for K through 8. So there will also be electronic versions available if you do feel as if that's what you would prefer. So we're asking you contact your special education manager or 504 school-based coordinator if you have any questions about supports and accommodations. And if you have issues with FCPS laptop or just technological infrastructure at all, just make sure to contact the IT service desk. You can email them at itservicedesk@fcps.edu, which, and again, it's itservicedesk@fcps.edu.
Perfect. Thank you, Kimberly. So with that, we will, there's one question that came in about grades. I will be answering that, and then we will move to the next segment of our program. And we're excited to have Ms. Hemmat here with us. So the question I see here, Bushra is asking, how will final grades be evaluated for high schoolers? The question I think we get every time we do a live stream. So I'll answer it real quick. So as we've mentioned, fourth quarter will be considered pass-fail. And what that means is it can't hurt your grade. You will have an opportunity on top of, pass-fail to improve your grade through something called a mastery of learning that your teacher is able to do. Your grade cannot go below what it was in third quarter. Normally what happens is you take quarter 1, 2, 3, and 4 and average them, and that's your final grade. Right now, something similar will happen where there's quarter 1, 2, and 3. Of course, because 4 is pass-fail, instead what opportunity is available to you is a potential boost as a result of what you show to be a commitment and improvement in your grade throughout this period. And your teacher is able to award that to you in the end. So that that average will end up being your overall grade. Okay, so with that, we are thrilled to have Ms. Joanna Hemmat. Thank you so much for joining us.
Yes, thank you.
Yeah, she is the Assistant Director of Health Services at the Fairfax County Health Department. As you all know, FCPS and the Health Department rely on one another. During the whole COVID thing, you know, a lot of what we were saying is we're waiting for information from the Health Department. So now we're excited to be able to communicate with them and have you see it and ask your questions. So maybe we'll start off, you know, Ms. Hemmat, if you can give us a sense of what even is the Health Department? What do you guys do? Who's involved? You know, what should the average person know about the office?
Yeah, well, thank you for that lovely introduction. So overall, I'll start a bit, I guess, with what is public health. And public health is a focus on the health of populations. So what is a population? It can be as small as your neighborhood or your school, or it can be your county, as it is in Fairfax County, your state, your nation, or even the world. So depending on the focus of the public health issue or whoever's working with it, their focus may change. So as an example, I would say we in the health department provide public health services in the school setting. There is a school health aide staffing the health room, and there's a public health nurse assigned to the school. And the community or population that public health nurse focuses on is that school community. And then in Fairfax County Health Department, we are focused on the entire county of Fairfax. And our focus is on promoting healthy lifestyles, promoting health among the populations, looking at disparities and trying to see how we can address the disparities in health that is experienced by different populations. We support some basic services for, well, more on access to services. We don't provide a lot of direct services other than those that are focused on preventing disease and promoting health, such as immunizations. We have STI clinics. We focus on tuberculosis prevention and treatment and communicable diseases. So that leads us to where we are right now, right? A big focus of public health is really communicable disease, and prevention of epidemics is what we hope for. Well, we are now not in the prevention, we are in a full-blown pandemic, and we are now in the phase of trying to address it as best we can, trying to prevent the spread of coronavirus in our community and trying to do everything we can to mitigate that. And I will also just say a little bit about public health and how it's different than other kinds of health services. So clinical services are focused on diagnosis and treatment of an individual. And so what I started out talking about is the population. We're really looking at more large groups of people and how we can address public health concerns and issues to promote the health of the population. And we focus a lot on communication, education. We provide guidance for policy guidance, and that brings us to FCPS. And we work very closely hand in hand with Fairfax County Public Schools. We have a memorandum of agreement. We provide the health services that I described a little bit earlier in the school setting, and we have regular back and forth and communication around regulations and policy that are implemented in the school system that have any kind of relationship with health. We have conversations, we have meetings, they are multiple times a day. And as we were really getting into this coronavirus in our community, we were having, like, I don't know, I mean, day and night, intense, lots of communication back and forth from every level. And it went all the way, certainly up to Superintendent Braband and our health director, Dr. Gloria. There were lots of conversations and lots of guidance provided by the health department, considerations that need to be very specifically made for a school system. And so we did all of that hand in hand, but ultimately decisions to close the school, which did happen, were made by the school system. What the health department does is provide the guidance and the recommendations, and that decision was made by the school system. So I would also say the Fairfax County Health Department is a county agency. We are a locally run health department by Fairfax County, and we work very closely with the Virginia Department of Health. And then in the situation we're in now, we work very closely with Virginia Department of Health and the Centers for Disease Control and Prevention. We follow their guidance to address the coronavirus. And I thought I would also, kind of get into a little bit of the statistics of what's going on to give you that picture. But I wondered how many of you know where we got COVID. Maybe you do, but I'll just go ahead and say it anyway. So coronavirus disease is COVID. It was discovered in 2019, so they call it COVID-19. Okay, so that's where that comes from. So most times you'll see COVID-19 now. And I have some of the data for today, and numbers are changing, rapidly, but reports of the numbers are done on a daily basis for our county and the state. So what I have globally, we are over 2 million cases at this time, with over 141,000 deaths globally. Nationally, the United States is over 660,000 confirmed cases of COVID-19, with over 33,000 deaths as of today. Virginia is at 6,889 confirmed cases and 208 deaths. In Fairfax County, as of today, we have 1,375 cases and 30 deaths. The average age of a confirmed case in Fairfax County is 51 years old. But it has affected everyone from infancy all the way up to 106 years old. So we have every age range impacted. And so I thought I'd also kind of go back a little bit in the history of how this started. As far as we know, it was in December of 2019 where it was first discovered in Wuhan, China. And they determined that it was actually from an animal, some wild animal. I think there's still some debate, but they thought maybe a bat to another kind of animal that then transmitted it through what they called a wet market or an animal market in China, in Wuhan, where people frequent. And that's how it somehow then jumped over to human transmission. In January 21st, actually, we had our first case in the United States was diagnosed, and that was linked to travel from Wuhan. And initial cases then started to move out of China, more and more, and we started to see it in some other countries such as South Korea, Japan, Italy, Iran, and we then had travel restrictions. If you remember, that all started around then too. Travel restrictions were enforced. The health department was involved with any international travelers coming from these countries. We would be informed of them. They would be reported to us. We would then monitor. They would be under quarantine, and we would monitor them for symptoms. Then moving into March was the first case in Fairfax County. March 9th, we had our first case, and that was related to travel. An elderly gentleman who had been on a Nile River cruise was positive. And then not long after, his spouse was positive as well. On March 13th, that was the magical day that FCPS closed the school system. I think I got that right. Isn't it March 13th? Friday? Right. Yeah, out of an abundance of caution, because as they started, and we started to see a greater spread in our community, moving more into what we consider community transmission, where community transmission is when we cannot identify exactly who transmitted the disease to who. So initially it was linked to foreign travel, these certain countries, and then gradually as it became more spread, it's what we consider community transmission. On March 21st, we had our first COVID death in Fairfax. Now on March 23rd, Governor Northam announced closure of all schools across Virginia. So it wasn't too much later, but Fairfax was one of the earlier ones. Across Virginia, all the way through the end of the academic year, schools are closed. Restaurants can only offer takeout services. Gyms are closed. Theaters are closed. Many shopping centers and businesses are closed. Personal care, hair salons and nail salons and such are all closed. So life is different. Gatherings of more than 10 people have been banned. And then on March 30th, the governor issued a stay-at-home order that until June 10th, one can only go out for essentials such as groceries and medicines, Walking your dog is allowed. Going outside for exercise, as long as you maintain social distance of 6 feet at least, and traveling to work, to and from work. So there's a lot of restrictions that we are still under. On April 3rd, the CDC recommended cloth face coverings in public settings where other social distancing measures are difficult to maintain. And so why is that? That's because they now had determined that one can transmit COVID before symptoms are showing. So we have these asymptomatic carriers. We even have some that maybe never really demonstrate symptoms, but are carriers of the disease. So that was another layer. It's another layer of adding ways to prevent the spread of the disease, is wearing the cloth face coverings. And why are we not recommending, all the other masks and face coverings, the surgical masks, and don't they provide more protection? Yes, they do. But we have a shortage of what we call PPE, or personal protective equipment, for healthcare workers. Masks, gloves, gowns, face shields, all of that is in a short supply. So there's decisions have been made and recommendations about when you really need to have an N95 mask, when is a cloth face covering completely adequate for what you need. So the general public, it's a cloth face covering. So then on April 15th, which was just yesterday, the governor extended the closures of the businesses that I mentioned earlier all the way until May 8th. So that's where we are. That's where we are today. And there's a lot going on, politically and nationally and at the state level as well. So I think every day is a new day, and we don't know exactly what tomorrow may bring, right? But we just really keep operating with a lot of flexibility based on the information we have. We learn more and more about this disease every day, which really does inform the actions we take and the recommendations that are made. Now, I haven't gone into too much about how it's spread. I think I have alluded to it a bit, but I think I'll go over that. It is spread through respiratory droplets. And so that means when someone coughs or sneezes into the air or into their hand, the droplets land on a surface, on their hand or on a surface, unless they cough or sneeze into, say, a tissue that goes right into the garbage. And then they may touch another surface that someone else touches, or they may, they may touch another surface. That person touches the surface, then it goes to their hand goes to their eyes, their nose, their mouth. That is where the virus goes into your body. It's transmitted through your eyes, your nose, your mouth. So it's so important, the preventive measures, which I'll talk about in a little bit, and also contact. So that's another, since when people cough or sneeze, if you are too close, or if you're close for a longer period of time, which is less than 6 feet from the person and there for more than 10 minutes, then the risk of transmission of the disease is much greater. So if you're in a grocery store and you're walking by different people in the aisle, you don't really have a risk of transmission. Yet, if there is somebody who does have COVID and they may be asymptomatic or not have severe symptoms, and they're in the grocery store and they cough into their hand, they touch that item on the shelf, but they decide not to get it. And then you come by and you pick up that item, right? And you put in your cart and you get it. And then your eyes are itchy and you itch your eyes, but you haven't washed your hands yet, right? That's how easy it is. It is so easy, yet it's also easy to prevent that transmission, but it is very easily transmissible on surfaces. And the symptoms usually show up 2 to 14 days after exposure. So that's kind of a wide range. It can be early, this is 2 days, or it can be as long as 2 weeks, 14 days. And the symptoms are fever, cough, dry cough, shortness of breath, malaise, achiness, kind of flu-like symptoms. And that can evolve into what appears to be like a pneumonia, a severe respiratory disease with difficulty breathing, which then when it gets really severe and worsens, one ends up going through usually the emergency room, admitted into an intensive care unit, on a ventilator, and there we go. So the disease can really take a rapid turn for the worse, but the impact that severity is usually on vulnerable populations. So those who are older, 65 and older, are considered a higher risk. Those who have chronic conditions such as heart disease, hypertension, immunocompromised, cancer, respiratory illness, having chronic respiratory disease, severe asthma. Those are the kinds of things that can put a person at a greater risk for this disease. The others who are at great risk are our healthcare workers, the frontline people. So even with the best intentions of PPE or protective equipment use, there can still be a breach of that protection, and they have been getting infected, and some healthcare workers have actually died from this disease. So healthcare workers, frontline, EMS, and first responders are at high risk. Those who are in nursing homes, long-term care facilities are at very, very high risk. They're in close quarters. There's not a lot of control over their environment. They have a lot of staff who actually move from facility to facility. So they're a very high risk population. Jails and other congregate living sites are also considered high risk settings. So the health department has been moving towards addressing some of these higher risk settings. Initially, we focused on the international travelers. We were able to identify each positive through a test and then do what we call contact tracing. So when there's a positive person for any communicable disease, and the way we are handling COVID is like we handle tuberculosis. It's like we handle a bad salmonella or norovirus outbreak. It is the same methodology we're using. It's basic epidemiology on public health. We identify the person through testing, confirm the case, identify the contacts that person has had, contact all the contacts, assess them for symptoms. Some of them may need to be tested, or they may be just simply by contact recommended to quarantine. Self-quarantine is to remain for 14 days, which is the duration of incubation for this illness. They're recommended to stay at home, quarantined from others. Very difficult, right? Very challenging circumstances that people must be under, monitoring themselves for symptoms, taking their temperature twice a day. And so that's what we do. And as the disease has spread more and more in our community, we are now focused where we're seeing the disease spreading more rapidly. Like if you really watch the numbers and you see the jump in the numbers, what we're seeing are, some of it is a delay in the reporting. So all of a sudden you might see a jump in 40 from the day before, and it could just simply be that the reports have come through over a longer period of time. And there's been more confirmed cases in nursing homes and long-term care facilities. And so once that happens, it's a little bit, it's very unfortunate because it spreads more rapidly, and the numbers have gone up quite a bit due to nursing home and long-term care facilities. So our focus now has really, really driven much more towards the high-risk vulnerable populations we see in nursing homes, long-term care, jails, healthcare workers, all of those very high-risk populations. And we are focused, over half of our staff now are focused on this. We have close to 300 staff that are what we call deployed into our emergency operation to address COVID, and working 7 days a week, sometimes in the middle of the night. We are here, we are working on this, and continue to do so. As more information comes in and we learn more and more about the disease, we have done things such as establishing a call center that we receive calls and answer questions as best we can from the community. That's open 7 days a week. We're working with the communication team from Fairfax County Public Schools and with the county to push out information and to get accurate information out there, because there's a lot of information, some of it not so good, a lot of rumors. And so we really, really think it's very important that people are relying on scientific information, good solid data, making informed decisions about their actions, and the recommendations we make are based on that. And so rumor control is very important. Myth busting is very important. So communication and education is really, really extremely a large focus of what we're doing now. And what can you all do, right? Well, there definitely are things that everybody can do, including all of you. There are power in your hands, right? So what I mentioned earlier about what in the grocery store example for that example is, it's very easy simply to keep your distance as best you can if you're going to be closer than 6 feet for longer than 10 minutes. So social distancing is one of the most important actions that you all can take every single day. For people like your family that you know the risks, that's not what we're talking about. We're talking about out there in the community where you don't know the health status of everybody else. And so the most important thing you can do is to maintain that social distance from others, which is why we have the governor's order, the stay-at-home order, and why schools are closed and why businesses are closed, to try to really maintain that and to do what we call flatten the curve. You know that you've heard that a lot. The curve is still going up. So we're trying to flatten that. We're trying to give our healthcare system a chance to be able to respond, to reduce the number of cases, reduce the spread. The other very important thing is washing your hands. You can't do it enough constantly. As whenever you think of it, washing your hands for at least 20 seconds with soap and water is the most important prevention. When you don't have access to soap and water, using an alcohol-based hand sanitizer, and keeping your hands away from your eyes, your nose, and your mouth. Hard to do. We all do it. So that's another behavior change that needs to happen. Staying home when you're sick, first sign of any kind of illness or sickness is to stay home. Isolate yourself from others. And if you're in contact with anybody who has been confirmed with COVID, if someone who has it tells you that you are a contact, then what you are to do is to quarantine yourself, stay home for 14 days. And then if you do develop signs of illness, you contact your physician, your primary care provider. You don't just walk in to a clinic or an emergency room. You need to contact them ahead of time. And then they will take it from there. So that's kind of, I think, pretty much all the information that I have to share, and I'm available for some questions. We're continuing to do, as I said, every day we learn more, and our actions may change by next week or next month. But for now, the focus is really the vulnerable populations and pushing out accurate information and communication.
Yeah, thank you so much. And absolutely, the education and communication piece is a critical aspect of all of this, of course, which is why we're so grateful for you for coming on, and why hopefully, all our viewers will share this information and tune in afterwards as well. I did want to ask about something you touched on. Well, first of all, maybe it would be helpful to define certain terms. So you mentioned quarantining.
Yes.
And that's something different than social isolation.
Yes.
Social distancing, right? So people, these kind of terms have been thrown around, and not always clear. So if you give us a sense for the community's sake as to what the differences are.
Sure. Well, I'll start with social distancing, since that's the, in a way, the easiest. Social distancing is what healthy people do to stay healthy in this situation. It is maintaining that at least 6 feet, which is what's been determined for coronavirus, is at least 6 feet apart from others. And if you're going to be there for more than 10 minutes. So that's what social distancing is. It is really trying to stay healthy by reducing your risk of being in contact with anybody who you have no idea what their health status is. And then isolation is when somebody is sick. And they are then given the recommendation or the guidance that they need to isolate, self-isolate, put themselves in their own space, preferably in home where they have their own bathroom and it's not a shared bathroom, where they're not sharing a kitchen. These are very difficult things to do, right? Very, very, very difficult. And so oftentimes many in our community are really, really struggle with that. And they need support. How do you get food? How do you do, how do you do a lot of the basics if you have to be isolated? So isolation is when identified as sick, you need to maintain yourself in that sort of self-contained environment where you will not risk exposing anyone else. Quarantine is when you're not sick, but you've been exposed. So you've been exposed to a known confirmed case, and then you are given that direction is to stay in similar to isolation in your own space, not interacting with, the bigger community for that 14-day period, because it takes 14 days for us to be sure that the incubation period is over. And if you are symptom-free after 14 days, then you're free to go. Does that make sense?
Yes, thank you. Absolutely.
Yeah.
Definitely want to make sure people, when they see things from the news or hear this conversation even, to know exactly what we're referring to. So focusing a little bit on Fairfax County specifically, there were a lot of questions as to how all of this unfolded. Certainly as a school board member, we received an onslaught. You mentioned how there's some reporting with the CDC or some guidance that you guys get. Do you mind walking us through? So we're here on a very local level.
Yeah.
Then there's the state that I'm sure you're in communication with, and nationally. And then, of course, there was talk on a national level about testing shortages and whatnot. So if you just give us a sense of what does that look like for you guys to receive that communication, to be in touch? What are the constraints and opportunities that are a part of that?
Yeah, well, it's kind of complicated. And at first, even with those travelers, the international travelers, the reports, it was like Customs and Border Control people and not local folks. Not our local health department that were doing the initial identification of a traveler of concern. So those staff who were deployed, some of them were, I think, from the CDC, and some of them were maybe from Customs and Border Control. I think it varied depending on the airport and the locality across the country. They would report those individuals through to the state health department. They have a system in place that they get reported to the Virginia Department of Health centrally. And then Virginia Department of Health would report to the locality. So Dulles Airport was one of 11 airports in the country that was identified to receive international travelers. Many of the people that did come through were Fairfax County residents, or they were, if not, then we actually had to identify places for them to stay. We had what we call quarantine houses that we were able to obtain, rent, and have space for those people. And so anyway, the notification comes that way. We're not the first to know. Basically, it goes through the state, and of course they notify the CDC as well, but they're notifying the local health department, and then we are the ones who follow up and do the local level monitoring. Here locally now, as testing is still very limited. It's not where we want it to be, but when a test is done by a local healthcare provider or Innova Hospital, for example, they are required to report a positive to the health department. And that is a requirement across the board for all communicable diseases that are considered reportable. They report to the health department. So there's an electronic system of reporting that feeds into our database. And there's sometimes that happens quickly and sometimes there's a delay. So that's why we see these variability with these reports on data on cases even, is because there are some delays. How quickly is the lab reporting it? How quickly is the healthcare provider reporting it? And then it feeds up into our system. And then as soon as we get it, we have teams that are working on this every single day, 7 days a week. They get the reports, they identify if that's a positive individual. They need to then identify the contacts. They contact that positive individual and ask that person to provide the names. We call it then a line list of people. They provide a list of names with contact information, and then we are reaching out to contact those people and say they were exposed to a positive individual, and then provide the guidance, which would be self-quarantine, for 14 days after the date of last exposure, and the monitoring for symptoms.
Thank you. Yeah, and that certainly was a part of, I'm sure, the collaboration with the school system too, because there were cases, right, that came out of our schools, and we had to make sure we were in touch with families and whatnot. So thank you. That was very helpful.
Yeah,
Yeah, and so also on the national level, there's this talk, and you mentioned the shortage in materials. I'm curious, your work with Inova, with the other health systems in our area, what does that look like here in our county?
Yeah, and that is a bit of a moving target. We are working with our state and other local emergency partners. So beyond the health department in the county of Fairfax, there is a larger emergency operations group, and they are actually, we kind of centralized the supply now for all we call PPE. And so we have we're, I think, basically the kind of the decision maker on the allocation of the PPE to make sure that those who are in need of it are getting it, because there is such a shortage. So we have some of that control over it, but there is a more centralized kind of repository now of the equipment. There is still there are still shortages of certain equipment. We now have hand sanitizer, yay. We don't have wipes, but we have hand sanitizer, and gowns are short, but we're getting masks. So, there's a lot of management. There are some, like some of the homeless shelters, I believe, and some of our federally qualified health centers, and some others that may be serving more of an underserved community and are now, well, and I don't know if the homeless shelters are doing the testing, but I believe our federally qualified health centers are. And it is very critical that they have the proper protective equipment when doing a test, because that is a very high risk for exposure when they're actually collecting the sample for a test.
Yeah, thank you. Even, looking ahead with ventilators and whatnot,
yeah,
I guess it's also unclear what the situation will be. We're lucky to be one of those communities that has a lower number of affected people, right?
Yeah, and now there's also UVA has come out with some modeling. I don't know if you're familiar. It came out on Monday, and I started to look at it, but I think I got distracted onto something else, so I didn't have a chance to really look closely. But I think it's very interesting. They've done, putting large data sets together, and have been working on various modeling scenarios of if the restrictions are lifted, the stay-at-home orders are lifted at this date, then we're looking at this kind of level of transmission. What is the capacity for our hospitals? What's the ventilator, supply looking like? So they've done a number of different kind of scenarios in modeling out across time for the state of Virginia.
Yeah, that's excellent. No, I appreciate you pointing that out, because even anecdotally, my father's a physician and has been sharing these stories with us of new instruction as to where certain patients are housed, or using one mask a day, that kind of thing. That's increasingly affecting and their own day-to-day. Or there's a certain day when they were fitted for masks, and if it didn't happen that day, then they're gonna have to figure out a different way to do it. And
there's been every day there's been new information, and some of it has to do with the new information about the disease, and then the CDC and others who are really working with it in every level of detail to determine when are the critical points of risk and exposure. So even with the use of PPE, that the greatest risk for a healthcare worker is when they're taking that protective equipment off, and they need to have a lot of controls over that in order to protect themselves. And then really defining when is it at the greatest risk where you need to have, the greatest amount of protective equipment. When is this more simple face mask adequate, because the risk of exposure is very low. So it goes for different kind of levels. But I think it's been very stressful for healthcare workers, because a lot of it is not what they're trained. It's not the way we all were trained to really protect and prevent, but this is looking at it and taking a very deep dive into when it's really, really needed.
Yeah, thank you. Certainly not a situation I think anyone has signed up for.
No.
We're all figuring this out now. So Kimberly is going to go ahead and help us with some of the questions coming in from Facebook. We want to make sure we take some of your audience questions here.
Yeah.
I'm going to turn my light on. It's getting kind of dark in here.
Is it motion? Yeah, I figured. Thank you. So Kimberly, go ahead.
Yeah. So we have Emily, and she asked, does Fairfax County Health Department continue to do contact tracing with newly confirmed cases these days?
Yeah, our focus now on the contact tracing is the high-risk populations that I mentioned, the nursing homes, long-term care facilities, congregate care like group homes, in jails, those kinds of settings now. So we started out doing contact tracing on any positive, but our numbers were very low at that time, and now our numbers are higher. And the intensity of need in those very, very vulnerable populations in the nursing homes are where we're really focusing all of our resources and efforts at this time. So yeah, that's how we're focused on the contact tracing. And then there has been information that's been pushed out, and I believe it was mailed actually to all residents of the county about.
I did receive it. Yes.
Okay.
Yeah.
But yes, what you as an individual can do if you are, confirmed positive or are confirmed as being a contact, and what you need to do, because it really, it's relying more on responsibility of individuals in the community to do this.
Okay.
Yeah.
Thank you for that. So next question, Heron asked, what is the status of accessibilities to coronavirus tests?
Oh, well, there's not enough. I will just say that we don't have enough access to it. There's a shortage of certain things, like they've had a shortage of the media that's used to, when they take the swab and they put the sample in a specific kind of media that transport it to where the lab will actually analyze it. They've had a shortage of that. They've had a shortage of swabs. So there's been certain things that have limited the ability to do testing, but some of those things are getting cleared up. So now there is the access to testing in testing sites, and NOVA has opened up several in the community, and then private physicians' offices, some of them have access to testing. Some of our labs, the private labs are doing it, but it requires a doctor's order or prescription basically to get it. You can't just walk in to any testing site and have a test because you want to. We're not at that point. So it would need to be with the provider or physician's assessment, determining that a test would be indicated, and they would either be able to do it in their own facility or they would recommend you go to another. The health department has a lab, and we are actually focused on some of the testing for the high-risk population. We collect samples. The nursing homes, for example, what I mentioned, we have teams that are going in when a case is identified. They're collecting samples on any potential contacts, and then we analyze the samples in our lab, and we're able to turn that around very quickly, and within a matter of a few hours, we get results. And then based on that, we're able to take our public health actions. We follow up with all the nursing homes, trying to make sure they're implementing our recommendations for temperature monitoring of staff, symptom monitoring of staff, limiting the risk of exposure to other residents and staff. So we're following up. We basically embed our staff there on a daily basis, going in to monitor and follow up. So I don't know, I kind of answered more than you asked.
That's wonderful. That's wonderful. So Heron also asked, is it possible to contract COVID-19 more than once? And I'm not gonna lie, I've had that question too, in terms of like antibodies and stuff.
Yeah, I don't think we really know. I mean, I've heard some say no, but I'm not sure we really know for sure. Yeah.
So that one's still up in the air. We're still
up in the air.
Yeah, I saw an article today that there was the possibility that they thought there were a couple of cases. So, but yeah, I mean, I'm sure it's, you guys know better than we do. I saw that, I think today or yesterday.
Okay.
Yeah.
So we have Mary, and I think as of right now, that's the last one we have on Facebook. And she asked, is there a way that the Fairfax County can somehow present in a graph or a visual context ways to like see like the curve or where we are, where we stand? Because I feel as if when we look at numbers, kind of sometimes we're like, what does this mean? I know that's one, like I'm not really a number driven person. So she wants to ask, is there a way that we could present it in that way?
To present for Fairfax County?
Mm-hmm.
That's a good question, because I would like to see it myself because I haven't. But there's a state graph. Mm-hmm. And so if you go on the Virginia Department of Health website, they just, I think it was just either very end of last week or it might have just been this week, they have expanded the reporting that they're doing, and it's reported by each county or each health district. So there is one, you can kind of hover over it, with your mouse, and it will, you can click on it and you can get more detail for Fairfax County. I don't think it provides a graph, what we call the epi curve for the county itself, but it provides it for the state. So that's a very good question. And I think our epidemiologists have been doing some graphing, but it hasn't become, publicized or public information yet. And some of it is, we also are always very sensitive to maintaining confidentiality of any health information. Any information that is reported on a communicable disease is considered confidential. And so we're very conscious of that when we report locations. We don't want there to be any kind of identifier. And you'll see it's handled differently in different states. So you will see in some states, and you'll see reports and they've got more detail down to where the neighborhood somebody's been in, lives in, but we don't do that.
All right.
Yeah.
And Abrar, before I ask the last question, do you have any more questions that you want to ask before we ask my last question?
I'm curious, whether it's doing the exercise of in the day of or thinking more broadly, but in particular, your work with the school system. I mentioned, I think we talked offline too, early on, how it was kind of a confusing situation for everyone. And there was a press conference, right, where folks said we were low risk, and give us a sense of how risk was assessed and what things looked like, with the collaboration there.
Yeah, we talked a little bit about that yesterday, and I had to think, gosh, that wasn't very long ago, but it seems like so long ago because things have just been such a rapid kind of change in everything. At that time, we were really following kind of case by case. And in the school system, there had been some risks of exposure, but it hadn't yet reached what we consider community transmission, which means that then we don't know the source of that person's infection. And that kind of is a bit of a trigger when it reaches that point where you don't know that source. If they didn't come in from a foreign travel or be a contact with that person who traveled, it could have just been somebody they encountered,